Hello, everybody. Good morning, good afternoon, good evening, wherever you are in the world. I'm Luis Eugenio de Souza. I'm the past immediate president of the World Federation of Public Health Association, and I'm proudly chairing this closing session of the Global Public Health Week of 2025. I have with me two very dear friends and important people in the public health community. Emma Rawson-Te Patu, who is an Nigerian woman, and the World Federation is very proud to have her as president, as the first indigenous woman to be president of our federation, the first one of a series, I hope. And Emma is a public health specialist and also an organizational development specialist that's working very hard to promote equity in our community, in our world. And also have with us Harsha Somaroo, the past president of the Public Health Association of South Africa, co-chair of our next Congress, the 18th Congress, World Congress on Public Health, that will be held in Cape Town, South Africa, from 2 to 6 of September in Cape Town, South Africa. Uh, Harsha is also a specialist in public health, passionate about health equity. I myself, besides past president of the World Federation, I'm a professor at the University in Bahia, in Brazil, in public health. This closing session, we're gonna talk about a kind of balance of our Global Public Health Week this week, but also especially about the forthcoming Congress, the 18th Congress. I would like to introduce this issue about our Congress. Remember that we are experiencing three interrelated crises: a rampaging inequalities related to income, wealth, and resource, environmental collapse, climate chaos, biodiversity loss, species extinctions, environmental degradation, and also mass populations movement, with increasing numbers of people in the global south seeking refugees from the social and environmental crisis. In 2025, despite some of the post-pandemic recovery reforms, unfortunately, things have grown much worse. In terms of inequality, we see some people becoming the world's trillionaires in 2027, even as a billion of people still live in extreme hunger and near extreme poverty. We have now crossed the 1.5-degree global warming red line, and we are transgressing six of the world's nine planetary life systems, while the fossil fuel industries, with the collusion of enabling governments, expand current production and explore more fragile sites to exploit. In terms of mass movement, in 2023, the number of people fleeing poverty, environmental catastrophe, violence, or all three, is close to 500 million, the highest number ever recorded. Our past 4 decades have seen a globalized and more predatory version of an economic system with one essential feature: the drive to make a profit, accumulate capital, and exercise the control power that comes from such wealth. In the public health field, the population's health on the world average had been improving since 2000 until 2020. Also, there were no significant reductions during that period in inequalities between countries or regions. The COVID-19 pandemic's long-term effects and the current crisis, in turn, are slowing or reversing the global trend of improvement and exacerbating inequities. Armed conflicts are directly affecting a quarter of the world's population, while the growing number of nuclear arsenal threatens everyone. The global population aged 65 years or above is projected to rise from 10% in 2022 to 16% in 2050, adding new challenges to public health. Health inequalities like social, racial, and geographical inequities are increasing. The current situation is well characterized as a syndemic, that is, the aggregation of different morbid conditions on a background of social, economic, and racial disparity that exacerbates the adverse effects of each separate condition. The 18th World Congress on Public Health will be an opportunity to discuss all these issues, and it will help the World Federation Public Health Association to put forward its mission, which states, protecting people and the planet, preventing disease, and promoting peace, health, and well-being. This mission can be accomplished through the advancing of 5 goals that are the goals of the Federation. The first one, advocate for peace, sustainable health equity, and global policies to improve the health of populations and the planet. Contribute to promoting system change and decolonizing public health. 3, contributing to strengthening and democratizing global health governance. 4, develop and advance public health knowledge, education, practice, and research. And 5, grow new and strengthen partnerships with groups or individuals who share our values. So I'd like to invite you all to come to Cape Town in 2026 to participate of this debate and to contribute to strengthening the public health community voice. At the end, all that crisis, all the current problems that we are living, we ask for the help and the support and the expertise of the public health community. So, to continue to our webinar today, to this presentation, I'd like to invite our president of the World Federation of Public Health Association, as I mentioned, a public health facilitator, organizational development specialist, an indigenous woman passionate for public health that's doing a very great job traveling all the world to promote health equity, Emma Rawson-Te Patu. Please, Emma, the floor is yours.
Well, tēnā koutou, tēnā tātou katoa, tēnei te mihi atu ki a koutou I te ata, I te ahiahi, I te pōrānei, puri noa I te ao. Hello, everybody. It's really wonderful to be with you at this closing session of Global Public Health Week 2025. And thank you very much, Luis Eugenio, for the kind introduction. I am here to speak about the challenges to global public health and also the opportunities as I see them. And thanks again, Luis, for mentioning I am on a very busy schedule this year because of many of the opportunities that have presented themselves to me in this past year and the year in front of me to be able to speak about some very important issues. And I'm going to focus particularly on the theme of this week's Global Public Health Week, which is redefining equity, decolonizing public health for a healthier world. And I'm very, very proud that the Federation has been able to bring this particular subject to the forefront of Global Public Health Week. But first, I must just do an acknowledgement to my family. Those photos that you see on the slide in front of you, really important to me as an Indigenous woman, that my family is always central to everything I do in supporting the work that we are doing. And I say we, me as part of the Indigenous Working Group, but also the family of the World Federation of Public Health Associations and the public health community. So I introduced myself in my language before and sort of greeted everybody around the world in my language. And so this is me, I am Emma, from Aotearoa, New Zealand, an Indigenous woman, as Louise has introduced me, and that kind of sets the context for where my position is that it is for global public health. I think before I start on some of the more specific stuff around the opportunity to decolonise public health, it's really key, I think, that one of the challenges that we have as a public health community is understanding all the parts of us. And that in some regards, we've become very siloed as a public health community. And I think coming back together, having a really good, clear definition that we all understand in terms of how broad our community is a really good starting place for a number of the other things that I think we need to utilise as an opportunity to grow stronger, particularly in the face of that we need to lean into, as Eugenio has really clearly outlined, some of the really significant challenges, and not least of which is the political determinants that really hinder so much of what we are able to do or what we believe we are able to do. I think often we think we know a lot, but often we find out we know very little, and so often we know not very much about a lot of things. And so, again, when I say this, it's really about how we come together in a different way to share the space that we have, to know our community in a different way so that we're working together better. Because as Eugenio said earlier, health inequities are increasing and we are in a climate health crisis. We are developing tools to mitigate many of the things that we see or to be able to do things faster and better. But sometimes that's not as good as it sounds. And what I think is a challenge for us is to lean into the fact that public health is political by its very existence. And I say that because I'm an Indigenous woman and I'm political by my very existence. So being comfortable with that and then leaning into what it means to be political as a positive aspect of public health. Because again, global health security is incredibly problematic these days, and we need to, as a community, use our ability to advocate for our communities, which is the global community, in the face of significant challenges to our peace and security. And so, enable to do that, one of the biggest things we need to understand and do differently, I believe, is leadership and how we future-proof by understanding and leaning into a different kind of leadership, one that's going to help bring along all of the people in a different way, because we cannot and will not, for some time to come, be able to control all of the choices of the governments that currently hold most of the power in terms of how resources are shared and how people experience health and well-being. So just in a way, we have to kind of summarise that, you know, what we need to do is understand how we as leaders in our communities are able to be committed to the things that we know are important. And again, I come back to that's about how we move together, how we support one another, and the types of emotions that we engage in being able to be in better relationship with one another, which is going to help us to be more efficient in our work so that we can ensure that all of the data, the science, whatever the science is, whatever the knowledges are that are needed, are translated into the efforts that we need to have seen in our communities in order to rebalance and create the equity that we know still is badly needed and does not exist. And this also includes how we are able to empower one another in the face of those political determinants, those political drivers that are negative to our health and well-being and shared resources, so that we can hold governments to account in a better and different way. And I'd like to give two examples of that. One is the example of Namibia just recently having made a decision to cancel US visas as a political move against some of the challenges brought about by the current administration in the USA. I'd also like to point to the really brave move that's happened in New Zealand in regards to the Treaty Principles Bill that was just struck down yesterday in Parliament, a historical moment where a bill that was introduced by a right-leaning government was beaten by the movement of community, of allies with Indigenous peoples to ensure that the Indigenous people's rights of that country, of my country, will still be able to be realised by moving against government en masse with a lot of energy, but was successful in the end. So these things can happen. And again, this is all about leadership that understands itself by being in better relationship with all of the people and the networks around us, and how we lean into relationship, but also means leaning into time, spending more time with each other, and not necessarily so focused on an outcome of a particular kind, because when you have better relationships with one another, you can make things move much faster. And so here we come back to, really clearly talking about decolonizing and some of the themes that I've mentioned throughout my presentation already. Again, there are definitions of decolonizing for the World Federation that has been highlighted earlier in the week on two of the previous webinars. So if people are interested in seeing the actual definition in writing, you can go back and have a look at the two webinars earlier in the week, the opening ceremony and then the one by the Indigenous Working Group. There have been stunning contributions to this theme this week, and I just want to touch on these particular aspects of action in terms of decolonizing, because when I talk about decolonizing, I'm talking about decolonizing leadership for better decision making in all areas. And so when we think about that, we need to talk about partnership, which I've mentioned before. How do we work in partnership with one another? How do we work in partnership with those most affected? So in order to raise the voices that need to be heard in the work that we do. This word manaakitanga is talking about giving without expectation of return. So the philosophy that underpins how we share power and how we share decision making. And authenticity again, how we authentically lean into our responsibilities and obligations to the people on our planet. Are we listening to hear and not to just respond? How do we listen to one another and truly hear what's being said to us so that we can then give the best contribution to the voices that we're listening to? How do I understand myself as a good ally to those most affected, those who have suffered the greater inequities? What does that look like for me in my position, in my work, in my job, in my place in my community? And then historical literacy. This is a really big one. If we understand our histories, then we're able to then acknowledge the challenges that we face, and again, the challenges in global public health, understand our histories, know our history, know our global history, so then we can actually put action and effort into the places that will actually transform and create change and be the opportunities for us. And ultimately, at the end of the day, it's constantly thinking about, am I being a good human? And again, this is just a bit of a summary of some of the things that I've been speaking about through the past minutes as I've been presenting this morning. Understanding our responsibility, we have an obligation to collectivise, to grow more movement mechanisms, to work together better, to address the political determinants and lean into that the opportunity that we have to do that as a public health community, address the commercial determinants of health, that which drives resource, which drives many things, including a lot of the political determinants. Understanding that there is still a global divide between the North and the South, and that we need to bring that together, because there are so many knowledges that are not meeting one another, and that if we do that better, then we're better equipped and better armed to do all the work we need to do. And understanding data. What is data actually? What kind of data are we looking at to inform the work we do? There are many different knowledges out there that are not being listened to or heard, and so how are we understanding what is data? And back at the beginning, I sort of touched on the need for a shared language, a shared understanding of who we are as a public health community, and how we have better clarity as a global community, and who we are and what we can do. And this other one that's kind of cheeky, but it's actually true, is to close this gulf of fragile masculinity. More women in leadership, more women in places of decision-making and power, as well as Indigenous peoples and others who are most affected by inequities. And then all of this can be helped and supported by leaning into empathy and leadership, how we show leadership, how we define leadership. And so for me, these are the really important things around, yes, we know that the science around the challenges and the facts around the challenges, but there are many more opportunities for us to be able to change what we see in the world in terms of global public health and the public health. So kia ora, Luis, and I'll hand it back to you. Ngā mihi, kia ora.
Thank you so much, Emma. You really showed the complexity and challenge that the public health community faces. We have besides all the problems the current situation creates, we have also opportunities. So it's important to be clear what are our goals and how can we achieve. It's not easy, but we have a good fight to fight. Thank you, Emma. So I'd like to invite Harsha Somaroo to talk about our Congress and her thoughts about the challenges and possibilities, opportunities of the public health community worldwide, and especially of the African community. Please, Harsha.
Great. Thank you so much, Louis. So yeah, I just want to reflect on the Congress. I think it's an amazing opportunity for the South African public health community as well as the global health community to really meet in Cape Town, the mother city, to reflect on the public health challenges of our times. I think the theme of the Congress, Health Without Borders, Equity, Inclusion, and Sustainability, is really relevant at this point in time that we find ourselves in with the global landscape of the political dimensions, as well as the inequities, as well as the issues of climate change and poorly resourced context as well. And so we really hope that this opportunity is not going to be just a Congress where people meet and talk, but really create a movement around building solidarity for global health. In addition to the talk, we really hope that it generates action that's inclusive as well as accessible and inspires the younger generations to take forward these challenges, especially in a time where there are so many innovations in terms of what we can do working together. Just to reflect on the Congress objectives, I think the Congress Management Committee has really reflected deeply on the theme and on the state of public health that we find ourselves in, and has developed really pertinent objectives for us to focus on as we are designing the conference, and also in terms of what we hope the discussions will really reflect on. And so one is that we want to develop a vision as well as actions for public health without borders, so that we really prioritize discussions around equity and inclusion. We want to advocate for a healthier planet. We want to advocate for health equity, as well as for peace in this time of conflict. We also want to take the opportunity to be able to disseminate not just global public health lessons, but also learn from the local language, local communities as well. We're very fortunate to be going to Cape Town, which is an incredibly global city. It's one of the leading technological spaces in the African region, but it also boasts a proudly indigenous community, the Khoisan people. And I think their rich cultural heritage and also the unfortunate marginalization of these communities over time has impacted their access to healthcare and social services. And they bring a lot of indigenous as well as life lessons for us in the public health community. I think this is also an opportunity for all of us to collaborate to strengthen and democratize global health governance. I think Emma spoke about the importance of leadership in this day and age, and I think this should also be a very important topic next year. It's also, as always, an opportunity to advance public health knowledge, education, practice, and research, and really looking forward to incredible scientific presentations so that we can empower the next generation of public health leaders to really take on the public health journey forward. And finally, we know that we need to protect public health in financially challenging times, and we hope that the theme of universal healthcare will really be a very important conversation at the conference. So I think the theme Health Without Borders, Equity, Inclusion, and Sustainability is very relevant, and it's really going to give us the opportunity to foster better regional solidarity as well as cross-border collaboration. It's also going to give us an opportunity to reflect on the technological advances that are being made, especially with regard to digital tools and how these can empower not just public health actions in the bigger cities, but also how the digital age can improve public health equity in the less advantaged areas and rural areas as well. This is an opportunity to have a stronger community voice and to really showcase public health leadership, global leadership, as well as local leadership to impact the future actions that we take. And it's really important for us to make sure that they are youth-led initiatives so that the next generation is well equipped to take forward the public health needs. I'm just going to reflect on the Congress governance quickly. I think Louis did mention before that he and I are co-chairs of the Congress Management Committee, but there are also other members from both the World Federation of Public Health Associations as well as the Public Health Association of South Africa, who are working very closely to make decisions related to planning of the Congress. And these include Bettina Borish, Emma Rawson, Emma's on the call, Letitia Rispel, she's also a past PASA president as well as a past president of the World Federation of Public Health Associations. So she really brings the two communities together in an excellent way. Louis, Mata Lamazi, Moketsi Madesanyani, Raman Bedi, and Sayendra Mudli. So we really have a strong team that's leading this planning phase of the Congress. We've also got an International Congress Committee. The co-chairs are Emma Luando Maki, who is the current PASA president, Tracy Naledi, who many South Africans will know very well. She's a public health medicine specialist based at the University of Cape Town, as well as Bettina Borish, who I think is well known to the global public health community via the World Federation of Public Health Associations. The International Congress Committee that they will be leading will consist of more than 80 leading public health area experts from around the world. So you can be sure that we're going to have a very credible approach to scientific planning, as well as a very inclusive process in terms of the abstract review, as well as planning the program. Just to give you some key dates, abstract submission is going to open this year on the 1st of September, and will close on the 30th of November 2025. I think it's important for people to note these dates because it's important for you to get your abstracts in before the closing date. These dates were planned to ensure that there's enough time for judging, and there's also enough time for people who are invited to present to secure funding. I think many academic institutions may take a few months, and so these dates allow for everybody to have enough time to plan for the Congress next year. So the Congress will take place from the 6th to 9th of September in Cape Town at the Cape Town International Convention Center. This is a world-renowned venue, and I think everybody will really have a great conference experience there because it is a really accessible and convenient venue, also in the city center. I've put some slides up on the registration fees, but I'm not going to go into it in detail. I just want to say that the Congress Management Committee has really reflected on the fact that we are having a Congress in the African region, in South Africa, and really negotiated the prices to be able to make it much easier for people from the Southern Hemisphere to have access and to be able to afford the registration fees. So I think when you convert it to South African rands, especially for the South African and African delegates, these amounts are really comparable to big local and international conferences that are already happening in the region as well. So it is a very affordable Congress. So we hope that your funding will not be at stake. In terms of the opportunities to participate, one is as a Congress delegate. It's also, there's a lot of opportunities to present your public health work. There'll be poster sessions, oral presentations, workshops, world leadership dialogues, as well as different types of symposia. And all of these will be available for abstract submissions as well on the conference website. There's also partnership opportunities for organizations to partner with the organizers to really promote the work that they're doing via knowledge sharing or as well as exhibition spaces. So you're welcome to contact us to get more information about that. There's potential for individual partner opportunities as well. And here, please do arrange meetings with the organizers so that we can discuss how to meet your needs as well as cater for the delegates at the conference. And there's a massive space for exhibition. So we really hope that you will take advantage of that. So yeah, before I go on, I just want to show you Cape Town so that you get a taste of what to expect. Okay, so I hope that gives you a good introduction to Cape Town. It's an amazing city. And so travel to Cape Town is really easy. I think it will be a wonderful travel experience. But more importantly, it's going to be an amazing public health experience with global dialogue, with policy exchange. We're going to have leading public health experts, as well as intersectoral innovation in a really big way. I think it'll be a very exciting experience for anybody who's interested to coming. So I encourage you to go to the website to get more information, and feel free to contact the organizers as well. And we look forward to welcoming you to Cape Town in September next year. So with that, I will hand back to you, Louis.
Thank you so much, Harsha. Wonderful presentation. If anyone had doubt about going to Cape Town to our World Congress, there's no more. Thank you very much. Very amazing Congress we're going to have in a very amazing city. Uh, I would like now to make one question to Emma, and then after to Harsha. Emma, are you experiencing a new job as president of the World Federation? And we know we are being invited for different places to discuss the world vision of the indigenous people. We know that for the last 4 centuries, the Western society has been guided by the ideals of enlightenment, idea that the human reason could rule the world. But even if you have some very important improvements in the quality of life, in the expectation of life, actually it was not spread all over the world. It has benefited a small part of the world population. And you've seen that this reason that was so we had so many expectations about a reasonable world has not been as it was promised in the Enlightenment. And we know that indigenous people have a different way of reasoning that I think is much needed in the world. How could you, how do you feel about chatting and in conversation with people of around the world about the possibility of all the global community, all the global population learn about the wisdom of the way of living of the indigenous people? Please.
Thank you, Louise, for the question. I suppose, yeah, it's good to focus on what I'm experiencing as I travel and as I'm invited to be in particular places, particularly to speak about decolonizing global public health, which really does, apart from my very existence, but it does centre Indigenous peoples at the front of the conversation around public health. And the first thing I would say is that I'm observing and experiencing a very genuine want to understand the situation for Indigenous people. And I think it's also really important to recognise that as a population, we're about 500 million people on the face of the planet, which is around about 6% of the global population. So we are not large. But I'd also like to, again, recognise what you said, Louise, for many hundreds of years now, our knowledges and actually our very existence has been erased. And so it's really interesting as I go around these days and have engaged in many conversations about many new definitions of public health or public health approaches, that people are actually talking about what Indigenous peoples have known for millennia. And so that's a really good opening, though, to really help people understand what it is that they're actually talking about when they think that they've come up with a new approach in public health. Because when we think about public health generally, it's a holistic approach to well-being and health. And Indigenous peoples have forever understood the holistic nature of health and well-being, and indeed the symbiotic relationship with the planet. Because without the planet, there are no people, and without people, there is no one to take care of the things that need to be taken care of in regards to the planet's health. In actual fact, one might question, is that necessary? And so, again, going back to the appetite that we're experiencing for people wanting to genuinely understand, it is definitely authentic, but it also takes a lot of work. And there are, as I just mentioned, 6% of the global population are Indigenous peoples. Half of those are not acknowledged in the places where they come from. Indigenous is an interesting word in terms of how people describe themselves. It is a collective noun that has been given to certain groups of people that have experienced certain situations. And many Indigenous people do not use that word to describe themselves. So these are all of the nuances and the things that we need to understand as a global public health community if we're really truly leaning into, what do we need to do on behalf of these communities that suffer the greater burden of illness and disease. How do we value the intelligences or knowledges of Indigenous peoples and excuse me, recenter those as just as important in terms of the kinds of knowledges that we lean into as Western science, or maybe more. So yeah, thank you for the question. It's a really big question. I could probably go on for ages, but also I want to say that I'm really excited about being in South Africa. I haven't been yet, and I've heard so much about the beauty of Cape Town, but more so because I'm really, really proud that this Congress will centre decolonizing as a theme, and it does acknowledge the Indigenous peoples, the Khoisan, in South Africa and Cape Town. So I am extraordinarily proud to be, to be the president at this time when we can centre this and make this at the forefront of the work we're doing. So thank you. Thanks, Harsha, and thanks, Louise.
Thank you very much, Emma. We are really in need of this kind of knowledge that the indigenous people bring to the world. We see so that the Western rationality has led us to a climate crisis that but endangers even the continuity of life on Earth. And so, as I'd like to go to Harsha to ask her about, we know that this climate crisis that we're living was not caused equally for all people in the world, but people who are suffering more for the consequence of this crisis are in the global south, even if they are not responsible for it. So certainly there is a divide that we need to overcome between North and Global South. So I would like to ask Harsha to talk how do you see, Harsha, this possibility of the contributions of the public health field to overcome the divide in actually promote equity in a very broad way? Please.
Thanks, Louis. I think it's really important for people to converge together to discuss issues. I think when we're separated by geography in the North and the South, it's very difficult to understand each other's perspectives. But when you're in one space, hearing each other, listening and understanding experiences directly from a person on a one-to-one level, I think it's much easier to be empathetic and to realize what some of the unintentional impacts are. There's a saying in Zulu, the South African language, Ubuntu. It means I am because you are. And it really centers around community and how we are so interdependent on each other and how we need to work together for the betterment of each other as well. And we hope that that will be a central theme at the Congress as well. And if we reflect on something like climate change, I think a lot of the greenhouse emissions occur largely in the global north, but the impact in terms of affecting public health is in the global south because the communities are less, they have more impoverished, they have weaker health systems to actually address the emerging issues. And even the weather impacts are actually stronger in the south of the world as well. So I think, we really need to reflect on all of this and how we all need to work together to address the root causes, to really decrease global emissions in a big way. I think as much as we have the COP conferences every year, which I think have made some progress over time, I think there's a lot of African voices that are missing because it's difficult for people to actually attend these conferences, which are largely in the global north, which are largely very expensive for people to attend. So the fact that we're having this World Congress of Public Health in South Africa is going to really increase access to a lot of South Africans, to a lot of Africans, as well as people in the global south, so that the conversations are more diverse, they're more inclusive. And I think it really is an opportunity for us to focus on not just the discussions, but also on the actions we need to take together.
Excellent. Thank you, Harsha. So that's it for our session on the World Congress on Public Health, but it's also the closing session of our Global Public Health Week. Emma had the opportunity to open this week on last Monday, and now we have some figures about how it was. It's this edition of the Global Public Health Week. So I hand over to Emma to say how did it go, Emma?
Yeah, thanks, Louise. I kind of alluded to it before about how proud I am that this week has been so focused on something that's so dear to my heart, which is decolonizing public health globally and redefining equity under that banner. And at the beginning of the week, yes, we mentioned that we were having 80 events in total across the globe, so webinars, social media campaigns, and panel discussions and the like, in many different languages, including English, Spanish, French, Arabic, Bengali, and Te Reo Māori. And that we've had almost 13,000 views and reached almost 5,000 individuals. And our events have created over 25 hours of watch time on YouTube, and over 100 new followers on our social media channels. And so again, it's just such an important affirmation that, the fact that we have had a Global Public Health Week focused on decolonizing global health and how well it's resonated around the world and how much people have lent into wanting and demonstrating how much they want to have these discussions, and indeed not just discussions, but discuss actions and share actions and resources about how we can go about doing this as a global public health community. And so I personally, as the president, would like just to thank everybody who has been part of each and every one of these events, and there's more that we probably don't know about that people have been holding in places around the planet. And also particularly want to thank the staff in the office. We have a very small office, and I know, Luis, you're going to give some further closing comments, but I would like to thank very much Martinique and Comms and Maria and all of the technical support that they have both been giving, and Marta indeed. So thank you very much from me, and thank you to our global public health community for all of this increased encouragement and work. So over to you, Luis. Thank you.
Thank you very much. I'd like to thank you again, Emma, Rawson-Te, Patu, Harsha, Somaroo, for being here and providing so insightful thoughts. And I'd like to invite you all that are watching this session or can watch it recorded after it to come to Cape Town to join us in the World Congress of Public Health. That will be a success with your participation. Thank you very much and have a nice day.